My name is Dr. Weik. For 10 years now, I've headed the Department of Gastroenterology and Internal Medicine at the St. Augusta Clinic in the city of Düsseldorf. Our department is equipped with 50 beds for inpatient care and includes a large outpatient center. I have been practicing medicine for 26 years now. I was born in Freiburg, graduated from medical school there, and began an in-depth study of hepatology, liver diseases, and for that reason I moved to Düsseldorf. Here I first worked for 8.5 years at the University of Düsseldorf, then at the University of Wuppertal. And since the year 2000 I've been working here at the St. Augusta Clinic. First as a leading specialist, then since 2008 as the head of the internal medicine clinic. As mentioned, our primary fields of medical activity are internal medicine with a particular specialization in gastroenterology and hepatology. More specifically, these encompass diseases of the gastrointestinal tract, pancreas, and liver. Our department specializes in the field of internal medicine, specifically including various thyroid diseases, lung conditions, and rheumatological diseases. Of particular medical interest to us are complex diseases of the gastrointestinal tract, the liver, the pancreas, and the esophagus, including Barrett's esophagus, Crohn's disease, ulcerative colitis, as well as other chronic inflammatory diseases of the colon mucosa. Diseases related to the presence of Helicobacter bacteria, chronic inflammation of the GI tract, cirrhosis, liver infections, hepatitis, as well as the entire range of oncological diseases of the gastrointestinal tract and lungs. It's important to note that our department specializes in gastroenterology and hepatology, and in Germany, our clinic serves as an educational platform for specialists in the field of internal medicine as a whole, including thyroid disease, circulatory disorders, atherosclerosis, rheumatology, endocrinology, and diabetes, all of which are internal diseases. Top-tier medical specialists from across Germany undergo advanced training here in gastroenterology, covering various diseases of the GI tract, pancreas, esophagus, and liver. Due to the high educational standards and clinical excellence offered by the clinic and our department, we serve as an official academic hospital of the University of Düsseldorf. Fulfilling this role is only possible with a very high volume of examinations, their high quality, and adherence to specific standards. To further emphasize our specialization, let me give you a few figures. For example, the total number of endoscopic examinations we perform is about 10,000 per year. Of those, 6,000 are gastro and colonoscopies, and 2,500 are endosonographies. Furthermore, we perform several hundred ERCPs, which are special endoscopic examinations of the bile ducts, pancreatic ducts, as well as the intra- and extrahepatic bile ducts. We also conduct bronchoscopy lung examinations and highly specialized diagnostic examinations of hemorrhoids with the appropriate therapeutic solution to the problem. These are also our core clinical specialties. Another exceptionally distinctive feature of the St. Augusta Clinic Department and the Düsseldorf Clinic Association is the remarkably high standards, speed of procedures, and the efficient organization of patient admissions. This means that when diagnosing patients with serious illnesses, we ensure the immediate transfer of information to all medical specialists involved. For example, in radiation therapy, oncology, hematology, abdominal or thoracic surgery, and general abdominal surgery. In other words, there is not the slightest loss of time between the initial diagnosis and the prescribed therapy. Thus, the complete resolution of a medical case typically takes 1 or at most 2 full days. We place great importance on preventive examinations. We primarily use endoscopic and ultrasound diagnostics, which means gastro and colonoscopy, endosonography, internal ultrasound of organs with a focus on diseases of the pancreas, lymph nodes, Hodgkin's lymphoma, leukemia, and so on. Our clinic is a leader in Germany in the field of early diagnosis of oncological diseases of the gastrointestinal tract. Undergoing timely and comprehensive endoscopic diagnostics can very significantly improve the prognosis for a full recovery. The total number of preventive checkups among German patients is consistently growing with each passing year. And what particularly strikes me is that more and more patients coming to Germany from abroad are visiting us specifically and intentionally for these preventive screenings. In this regard, I would like to highlight first and foremost the professionalism and excellently organized logistics at DKA, the German Klinik Allianz, with whom we have worked together for many years and which manages a very large number of Russian-speaking patients. And this is very important because thanks to their professionalism, we are able to prevent very severe oncological cases,